The ambulance was not always what we know today. In the early days of America, emergency medical transport was less about saving lives, and more about moving bodies. In the late 19th century, ambulances were little more than wagons pulled by horses. They carried the injured over cobblestone streets, often without trained medical staff, without equipment, and without any real chance of treatment along the way. Survival depended not on speed or skill, but on luck. There were no paramedics. No protocols. No radios. Just urgency, chaos, and hope. As American cities grew, so did the number of accidents, industrial injuries, fires, streetcar collisions. Hospitals began to realize that what happened before a patient arrived could mean the difference between life and death. By the early 20th century, motorized ambulances slowly replaced horse-drawn wagons. Many were operated by hospitals or fire departments, signaling the first step toward organized emergency response. Still, these vehicles were limited. They transported, but rarely treated. For decades, ambulances served primarily as fast-moving stretchers. Inside, there was little more than a cot and basic first aid supplies. Medical decisions were made at the hospital, not on the street. In many cases, the ride itself was the most dangerous part. Everything began to change in the 1960s and 1970s. America was facing a crisis. Studies revealed that trauma deaths on highways and in cities were unacceptably high, far worse than on the battlefield. The realization was brutal: soldiers wounded in war were more likely to survive than civilians injured at home. That moment changed everything. The modern emergency medical services system was born. Ambulances became mobile treatment units. Trained paramedics were introduced. CPR, defibrillation, oxygen therapy, and trauma care moved from hospital walls into the streets. The ambulance was no longer just transportation, it became the first hospital room. By the 1980s and 1990s, technology accelerated. Radios connected paramedics directly to emergency rooms. Cardiac monitors allowed real-time diagnosis. Sirens, lights, and standardized designs turned ambulances into instantly recognizable symbols of help. But progress didn't stop there. In the 2000s, American ambulances became smarter, safer, and more precise. Digital systems tracked vital signs. Strict medical protocols guided every decision. Training became rigorous. Response times were measured, optimized, and audited. And then came the present. In 2025, the American ambulance is a moving network of technology and human skill. Some are electric. Many are connected directly to hospitals through telemedicine. Paramedics can transmit live patient data before arrival. Tablets replace clipboards. Precision replaces improvisation. Yet, despite all the innovation, one thing has never changed. When an ambulance arrives, it carries more than equipment. It carries trust. It represents decades of hard lessons, countless lives lost and saved, and a promise made again and again, that help is coming. Faster. Smarter. Better prepared. From horses to hybrids. From wagons to mobile ICUs. The evolution of the American ambulance is not just a story of machines. It is the story of how a society learned that every minute matters.
Bye everyone, thanks for watching and don't forget to subscribe to my channel.